Hello and welcome back to my channel. Today we're diving into an important neurological condition that affects millions of people around the world, Parkinson's disease. Whether you or a loved one has been recently diagnosed or you're just trying to better understand the condition, this video will walk you through the basics. We'll talk about what Parkinson's disease is, the symptoms to watch out for, how it's diagnosed, and the different ways it can be managed to maintain quality of life. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Parkinson's disease is a progressive neurological disorder that primarily affects movement. It develops when certain nerve cells in the brain, especially those in a region called the substantia nigra, begin to deteriorate or die. These cells produce a chemical messenger called dopamine, which plays a crucial role in transmitting signals within the brain that coordinate movement. As dopamine levels drop, the brain has more difficulty controlling muscle activity, which is why people with Parkinson's disease experience symptoms like tremors, stiffness, and slowness of movement. Over time, the condition can also affect other areas of the brain, leading to changes in mood, behavior, and thinking. Parkinson's is typically diagnosed in people over the age of 60, but it can occur earlier, especially in rare cases of young-onset Parkinson's. The condition affects both men and women, although men are slightly more likely to develop it. While the exact cause of Parkinson's disease isn't fully understood, researchers believe it's likely the result of a combination of genetic and environmental factors. A small percentage of cases are linked to inherited gene mutations, especially in individuals with a strong family history of the disease. However, most cases appear to occur sporadically without a clear genetic link. Exposure to certain environmental toxins, such as pesticides or heavy metals, has been associated with a slightly increased risk of Parkinson's, though this link remains under investigation. Inflammation, oxidative stress, and the abnormal protein accumulation in the brain, particularly a protein called alpha-synuclein, also seems to play a role in the development and progression of the disease. Parkinson's disease presents with a wide variety of symptoms, and these can differ significantly from one person to another. Symptoms usually begin gradually and may initially affect just one side of the body. Over time, they typically progress and affect both sides. One of the hallmark symptoms is a tremor, an involuntary shaking that often begins in the hands or fingers. A common pattern is a resting tremor, which means the shaking occurs when the muscles are relaxed and tends to lessen during movement. Another major symptom is bradykinesia, which means slowness of movement. Everyday tasks like getting dressed, walking, or brushing your teeth may take much longer. People with Parkinson's often notice that their steps become shorter and their movements less coordinated. Muscle stiffness or rigidity is also common. This stiffness can limit the range of motion, cause discomfort, and sometimes lead to a shuffling walk or stoop posture. People may also develop decreased arm swing while walking or a tendency to freeze mid-step, especially when navigating tight spaces or turning. Balance problems and postural instability can develop in the later stages, increasing the risk of falls. These issues are often subtle at first, but may become more pronounced as the disease progresses. In addition to motor symptoms, Parkinson's disease can cause a number of non-motor symptoms, which can sometimes be even more disruptive than the physical issues. These can include depression, anxiety, fatigue, sleep disturbances, constipation, difficulty swallowing, urinary problems, and a reduced sense of smell. Some individuals may also experience changes in speech and writing, often noticing that their voice becomes softer or that their handwriting becomes small and cramped, a condition known as micrographia. As the disease advances, cognitive changes may occur, including difficulty concentrating, slower thinking, and in some cases, dementia. Not everyone with Parkinson's develops dementia, but the risk increases over time. Diagnosing Parkinson's disease can be challenging, especially in early stages when symptoms may be mild or resemble those of other conditions. There is no single test that can confirm the disease. Instead, the diagnosis is based on a combination of clinical history, physical examination, and the presence of key motor symptoms. The doctor will evaluate the patient's medical history, ask about symptoms, and perform a thorough neurological exam. They may look for signs like resting tremor, rigidity, bradykinesia, and a postural instability. A good response to Parkinson's medication, especially levodopa, can also support the diagnosis. If a patient's symptoms improve significantly with this medication, it's often considered strong evidence of Parkinson's disease. In some cases, imaging tests like MRI or a specialized scan called a DAT scan may be used to rule out other conditions that mimic Parkinson's, such as an essential tremor or certain types of atypical Parkinsonism. However, these tests are generally used as supportive tools rather than definitive diagnostic methods. While there is currently no cure for Parkinson's disease, there are many effective strategies to manage symptoms and maintain quality of life. The treatment plan will vary based on the individual's symptoms, stage of disease, and overall health. Medications are the mainstay of treatment and are typically started when symptoms begin to interfere with daily activities. Levodopa is the most effective and widely used medication for Parkinson's disease. It's often combined with another medication called carbidopa, which helps prevent levodopa from breaking down before it reaches the brain and reduces side effects like nausea. Levodopa works by replenishing the brain's supply of dopamine and is highly effective at improving motor symptoms. However, long-term use can lead to complications such as motor fluctuations, where the medication's effect wears off before the next dose, or dyskinesia, which are involuntary movements that occur when dopamine levels are too high. Other classes of medications include dopamine agonists, which mimic the effect of dopamine in the brain, and MAO-B inhibitors, which slow the breakdown of dopamine. Anticholinergics may be used to help control tremor in younger patients, although they are less commonly used due to potential side effects. Each medication comes with its own set of benefits and risks, and your doctor will work with you to find the best combination for your situation. As the disease progresses, adjustments in medication timing and dosage may be necessary. Some patients may also benefit from advanced therapies like deep brain stimulation, or DBS. This surgical procedure involves implanting electrodes into the specific area of the brain to regulate abnormal brain activity. DBS is typically reserved for people who have had Parkinson's for several years and are experiencing significant motor complications despite optimal medication. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, beyond medications, lifestyle changes and supportive therapies are essential components of managing Parkinson's disease. Physical therapy can help improve balance, flexibility, and strength, reducing the risk of falls. Occupational therapy focuses on adapting everyday tasks and environments to maintain independence. Speech therapy can assist with voice volume and clarity if speech becomes affected. Regular exercise is one of the most beneficial things someone with Parkinson's can do. Activities like walking, swimming, dancing, and Tai Chi have been shown to improve motor function, balance, and overall well-being. Staying active also helps combat some of the non-motor symptoms such as depression and fatigue. Mental health support is another critical part of comprehensive care. Dealing with a chronic illness can be emotionally challenging, and many people with Parkinson's experience depression or anxiety. Counseling, support groups, and in some cases medications can help manage these symptoms and provide much-needed emotional support. Nutrition also plays a role in managing symptoms. While there's no specific Parkinson's diet, eating a balanced diet with plenty of fiber can help with digestion and constipation. Staying hydrated and maintaining a regular eating schedule can also support overall health and medication absorption. Sleep issues are common, so practicing good sleep hygiene, like keeping a regular bedtime, avoiding caffeine late in the day, and creating a restful sleep environment can be helpful. If sleep problems are severe, your doctor may recommend medications or refer you to a sleep specialist. Living with Parkinson's disease can be challenging, but it's important to know that many people continue to live active, fulfilling lives for years after the diagnosis. Thanks to advances in treatment and supportive care, individuals with Parkinson's are living longer and maintaining better function than ever before. Parkinson's is a highly individualized condition, and the course of the disease can vary widely from person to person. That's why it's essential to work closely with a healthcare team that understands your unique needs. Regular follow-up with a neurologist, along with support from physical therapists, speech therapists, mental health professionals, and caregivers can make a big difference in your quality of life. Building a strong support system, whether through family, friends, or support groups, can also help you stay emotionally grounded and better equipped to handle the ups and downs of the condition. Thank you for watching. As always, take care of yourself and make the most of your day.